The aim of my talk is to share with you an overview of the rationale and also the concepts on which relies the development of probiotic-based therapies we're actually designing. So this is, well, this doesn't work. This is not a surprise, actually. This slide, you've seen part of it this morning. When thinking globally and when considering progresses in medicine during the 20th century, if you consider this progress, clearly we have cut down the epidemiology, the incidence and prevalence of infectious diseases, some cancers, some cardiovascular events. But the other side of the coin is that the increase in terms of chronic diseases has been huge. So when considering progress, you have to balance the judgment. As a result, actually one human being out of 4 on the planet actually is concerned by a chronic condition. So when considering this fact, what have we missed out? So let's back once again to evolution. What has drastically changed since the occurrence of Homo sapiens on the planet is that we have drastically changed the behavior regarding microbes, that's for sure. We have also changed the way, the methods of childbirth. We have definitely change our behaviors regarding nutrition and daily activities, exposures to xenobiotics. You have to read the papers today regarding the problems with endocrine modulators. And we have drastically also forgotten that 50% of our cells are bacteria. It represents over 1 kilograms of biomass within your body, and 70% of which are pretty unknown because of culture problems, most of them being anaerobic bacteria. Michel Nunlis this morning presented us something that was close to this. Actually, if you consider the richness of the genes of the humankind genome, it represents 26,000 genes. And when you consider the number of genes that are harbored in the intestinal microbiota, it's rather 3.3 million genes. That is a huge difference. And considering that there is no relationships one with another is just not logical. When considering microbiota, actually this topic has raised 10 years ago thanks to the progresses made with the technology of metagenomics. And if you have just a look at Medline with the keyword microbiota, you can see this exponential curve of papers regarding microbiota. So, let's go back to the chronic conditions. Actually, if you consider the common thread of chronic conditions, you have to admit that there is an inflammatory state, at least a low-grade inflammatory state, associated with an intestinal hyperpermeability, the so-called Leaky Gut syndrome. The problem is that there is no current treatment for this, and there is no any preventive issue. And this is a common thread to neuropsychiatry, to gastroenterology, to metabolic disorders, and also to kidney disorders. And you can see some examples, and obviously it's not exhaustive. If you consider the symbiosis between the host and the microbe, actually, the microbiota plays a critical role in the maturation of immunity. If you consider a healthy person, actually, beneficial commensal bacteria have here, they induce well, hopefully David Klessman will confirm this someday, but they induce the activation of Tregs. Actually, they also have an induction of the interleukin 10 and the Reg3 gamma system. Conversely, they block the pathogenicity of the pathobionts, the bacteria that in normal conditions are just commensal, but in the condition of a disease, they become pathogenic. And on the other side, once the patient has an inflamed state, this system is totally blocked, and the beneficial effect of the commensal bacteria disappears, and you have all those problems related to this. If you have a look of the way the microbiota is built, actually you have to think this is a very dynamic system from birth to the elderly person. Actually, the microbiota needs time to be mature. We consider that it takes 10 years, but some say 7 years. Others think that adolescence is critical. Actually, the maturation of the immune system and the development of the microbiota are two sides of the same coins once again. It provides trophic functions, it contributes to the metabolic patterns, to the barrier function, and not only the intestinal barrier, but also the brain-blood barrier. I will come on this a little later. If you consider the disruption of this system, of the ecosystem balance, actually it rises the risk of infection. And if you consider the disruption of the tolerance of the bacteria that live inside your gut, it rises the risk of immune or inflammatory disorder. And this gives me the opportunity to propose a new terminology, because when considering a human being, we're all used to saying that homeostasis is something that is really important. But when considering an ecosystem, such as the gut microbiota, it is difficult to apply it. So we propose that beyond homeostasis, the host-microbe interaction could be considered as a symbiosis. Symbios for living together and stasis for standing still, and this new terminology could be defined as follows: the ability of the host and its microbial ecosystem to adjust their relationships to maintain a state of dynamic constancy. Obviously, this is a meeting on neuropsychiatry, and uncovering how this microbiota, and especially the intestinal one, impacts on brain and behavior could lead to novel therapies. So this takes me to the so-called brain-gut axis. There are many factors influencing the development of the microbiota, among which nutrition, the method of childbirth, the use of antibiotics, the xenobiotics, the environment, and so on and so forth. This is an interesting slide. Actually, you have to figure out the neurodevelopment sequence. And if you have a look on the richness and diversity of the microbiota all along the lifespan, actually, and you compare it with the density of the synaptic density, there is something really close. And if you have a look at the lower part of the slide, the incidence of the psychiatric disorders is related in some way to those patterns. The stability of the microbiota is critical also. those ecosystems are very resilient, but this stability can be impaired by many factors. You can see on the bottom, could be stress, diet, probiotics, pregnancy, antibiotics, the age, type of birth, etc., etc. And those, to be very caricatural, those factors lead to BDNF reduction and an activation of the microglia via an increase of cytokines. And it drives different psychiatric and neurological conditions. How does this work? Basically, there is quite a huge amount of data now that I won't say that the mechanistic way of action of the microbiota has been unveiled yet, but we have pretty much some ideas on the way it works. Actually, on this slide, you can see several mechanisms of action. The microbiota actually activates the enteroendocrine cells and activates the monoamine pathway. It also has an impact on the immune system, and a huge impact on the immune system through the production of cytokines. The microbiota produces many neurotransmitters. We are used to thinking that neurotransmitters are produced by our own neurons, but not only. There are many bacteria that produce GABA, that produce serotonin, and so on and so forth. So the impact of this neurotransmitter production has to be considered when discussing neuropsychiatric conditions. There are also many metabolites, such as fatty acids, such as defensin, protectins, and so on and so forth, that are produced by the intestinal microbiota. There is also something really interesting, which is a direct impact of the intestinal microbiota on the vagus nerve. And this impact is reciprocal. And there is something that Michel Nunlis has quoted this morning, and it was the subject of his talk, very interesting, and it's not on this slide. It's the relationship between the enteral nervous system and the microbiota. So when considering microbiota and psychiatry, let's have a small focus on this intestinal barrier disruption. In psychiatry, actually, there are many works in rodent models, but also in humans, showing that the intestinal disruption leads to the translocation of LPS, of lipopolysaccharides, but also bacteria themselves can be translocated, and the metabolites such as the fatty acids, such as the different protectins and defensin, and so on and so forth, produced by the microbiota. Those obviously, those metabolites obviously come into our system and into the plasma, the extravascular system, and they are propelled to the brain and to the blood-brain barrier. When considering a leaky gut syndrome, it's useless to imagine that it has no impact on the blood-brain barrier, sorry, and it probably, and I will not be positively affirmative, but it probably is one of the mechanisms leading to neuroinflammation, as shown on this slide. So the question is, are probiotic relevant for neuropsychiatric conditions? Actually, you should know that probiotic doesn't mean anything in terms of therapeutical class. The effect of a probiotic, of a single probiotic, is not dependent on the species. It depends on the strain. Within a same species, you can have probiotics that have totally opposite effects. And some of those effects are, as I said previously, to produce metabolites that increase both the diversity of the commensal bacteria and the availability of nutrients. Some of them increase the production of tight and adherent junction and could resume the intestinal permeability. They inhibit the passage of the LPS, or the LPS is produced by gram-negative bacteria, but lipotecoidoacid, LTA, are produced by a gram-positive bacteria. Both are translocated in pathological conditions, and so on and so forth. They also help the production of mucus. They also have direct impact on the PRR, as it has been shown previously. So to make a very long story short, probiotics could help in terms of energy metabolism. It may be improved by probiotics. It helps in terms of mucosal barrier. It helps in terms of immunomodulation, and it helps in terms of balancing the microbiota. And I will take this occasion to present some slides regarding autism spectrum disorders. So as it had been shown, it is a huge public health problem, and there is an urgent medical need to resolve, as the press and the general press is very, very, very important on the topic. So if you consider the traditional view of ASD, it is as follows. In the center, it is the DSM categorization of ASD, and you can see surrounding this, this core symptoms, many comorbidities, many biomarkers, potential biomarkers, and also the genetic patterns. Some years ago, a couple of years ago, there is another perspective that came out. And this is really interesting. You can see that now we could consider that the genetic, the environment, and the immune system could be considered as the core problem of ASD. And around this, you have the microbiome, that is very important thing that wasn't considered previously. You have obviously the comorbid conditions, the toxicant exposure, the environment, the cytokines, the immunity, and especially the autoimmunity. You have the type of birth and the maternal immune activation that has came, and also epigenetics that has recently came on the field. ASD is associated with a dysbiosis, with a problem with the intestinal ecosystem. There are many, many papers. Now we are about to find signatures on the different phenotypes, but this is an ongoing field that is increasing in terms of data. And if you consider what I was talking about in terms of brain-gut axis, but especially regarding autism. Actually, you have the same function of the microbiota. You have the two impacts on the immune system and the neuroactive compounds I was talking about. Those lead to a blood-brain barrier defect and having this whole system a problem. In terms of maternal immunoactivation, it's not just a question of mice. It was a very interesting talk, and Ellen Xiao has shown this previously in humans. Actually, if you consider those huge epidemics in the 60s, in the 80s, in different places of the world, they were all associated with an increase in the epidemiology of ASD. And I won't come back on this maternal immune activation, but it has shown that there is a very strong impact of infection during the pregnancy. What is new is considering the method of childbirth, and it is very interesting to see that C-section increases relative risk of ASD by 23%. It is interesting that C-section is associated with a delay in cognitive and motor development at the age of 9 months. And finally, children born by C-section are approximately 20% more likely to be diagnosed with ASD. Last but not least, as a risk factor, epigenetics. To be short, you have methylated or acetylated genes. Methylated are block genes, acetylated are ongoing genes. And the paternal sperm genome-wide DNA methylation some patterns have been associated with a 12-month ASD relation phenotype. This is very interesting because of, well, that's, I will skip this one. Because it will make us focus on the way epigenetic can be modified, especially through anti-reactive, anti-oxidative products. So I'm almost done with this. Our idea is to change the way we design probiotic products. Until now, it has been mostly empirical. We just gave probiotics, it works, it doesn't work. We have many papers, positive, negative ones. And we have now the possibility to have a bottom-up approach instead of a top-down approach with a really mechanistic and a strong rationale behind this. The idea is to modulate the ecosystem from an ecosystem that is resilient and to modulate it in another stability pattern. There are two ways to do so. Either you modulate it from an ecosystem to another one, could be more profitable than the other one, and if there is a strong dysbiosis, that will require a reset, total reset of the microbiota, and this can be done only with fecal microbiota transplantation. And last but not least, this is the concept on which relies the way we conceive probiotics. In a normal, healthy individual, the microbiota is rich and diverse. And it has relationship with the mucosal barrier. It leads to an immune tolerance and redox, an oxidative balance. All of those makes a nice circle that leads to symbiosis. If you add problems such as xenobiotics, if you change nutrition, if you give longer antibiotic courses, you may have, after this, a low richness microbiota with the loss of the symbionts and the beneficial commensal bacteria I was talking about previously, and an increase of pathobionts. The intestinal permeability will increase, raising the inflammatory pattern and the oxidative stress, and this is a vicious circle leading to a durably altered dysbiosis. The idea is exactly the same as the one virologists used for designing products and designing treatment for HIV. If you give one antiretroviral, it doesn't work. 2, it works, but not that long. And it became really interesting if you targeted 3 different sites. And this is the way we're working. Actually, probiotic is just one mean, but acting at the same time on inflammation or oxidative stress or intestinal permeability will probably lead to better outcomes. And this is what we try to do, targeting the intestinal barrier, targeting the oxidative stress, and targeting the immune modulation. For this, we have 3 huge programs, with 2 with INRA and 1 with AgroSup. And that's it. Hopefully, we will be able to come to clinical trial next year. Thank you.